shocking changes are unfolding at the CDC. Could the very foundation of U.S. vaccine policy be shifting? This week, 5 new advisors joined the U.S. Centers for Disease Control and Prevention's Vaccine Committee, and their appointment by the CDC and the Department of Health and Human Services, HHS, is stirring intense debate. The reason? Several incoming members are known for their skeptical attitudes towards vaccines, as well as their limited experience in immunization science, potentially signaling a more anti-vaccine approach within a committee that shapes the health of millions. But here's where it gets controversial. Some of these advisors have expressed doubts about the safety and effectiveness of vaccines, and have even questioned other public health measures meant to curb infectious diseases. Their arrival comes shortly after respected senior health officials left their posts, citing pressure to support decisions that lacked solid scientific backing, such as controversial changes to COVID shot eligibility and access. Dr. Tara Smith, an epidemiology professor at Kent State University, points out an uncomfortable reality. It seems their selection was motivated less by vaccine expertise and more by their vocal opposition to COVID vaccines. Smith worries that the new members could use their positions to limit vaccine availability, noting the committee's published agenda appears geared towards such restrictions. Public health scientist Jessica Steyer, founder of Unbiased Science, echoes these concerns. She argues the real issue is the systematic replacement of long-time vaccine specialists with appointees who publicly challenge the scientific foundation of vaccines. It's especially troubling right now, she warns, with active measles outbreaks and respiratory viruses on the horizon. Any policy changes based on inaccurate interpretations could have immediate repercussions. Even if the new advisors ultimately vote to support certain vaccines, Steyer worries the mere display of skepticism and anti-vaccine rhetoric can undermine public trust and cause lasting harm. And this is the part most people miss. This week, the Advisory Committee on Immunization Practices, ACIP, is scheduled to vote on 3 critical immunizations: the combined measles, mumps, rubella, and chickenpox vaccine, the hepatitis B shot given at birth, and the COVID vaccine series. According to Steyer, their decisions could dramatically shape the health landscape for U.S. children. These votes could limit parental options, she says. Without ACIP's backing, insurance might refuse to cover vaccines, and essential programs like vaccines for children could end up leaving families unprotected. One former CDC vaccination chief is raising the alarm about possible delays in recommending the hepatitis B vaccine, typically given at birth, to as late as 4 years old, considering hepatitis B infections among young Americans have dropped by 99% since introducing the birth shot. A delay could reverse decades of progress and trigger a surge in cases. There's more. The committee may also set stricter limits on who can get the COVID vaccine, possibly by using unverified reports from the Vaccine Adverse Event Reporting System, VAERS, as if they are established facts. Steyer compares this to treating every 911 call as definite evidence of a crime, a flawed and misleading approach. So, who are these controversial new faces? Several have made headlines for opposing vaccines and pandemic precautions. Catherine Stein, a Case Western public health professor, has referenced Christian teachings to justify rejecting measures like face masks, incorrectly claiming masks harm wearers, and downplayed coronavirus risks even during deadly surges. Off-campus, Stein has collaborated with Health Freedom Ohio and the anti-vaccine group Children's Health Defense, once led by Robert F. Kennedy Jr., now at HHS's helm. She's also signed open letters urging a rollback of vaccine mandates in schools and daycare. Kirk Milhoan, a Hawaii pediatric cardiologist, warns against COVID shots due to the rare risk of myocarditis, heart inflammation, despite mainstream science finding this risk extremely low compared to the dangers of COVID. Milhoan is a senior fellow at the Independent Medical Alliance, which previously promoted unproven treatments like ivermectin for COVID-19. Although the Hawaii Medical Board challenged his license over pandemic misinformation, he ultimately remained able to practice. Evelyn Griffin, once an OBGYN, now a holistic health advocate, recently alleged that vaccines present hidden dangers and criticized medical education for teaching doctors to unquestioningly support childhood vaccines. She's spoken at events opposing vaccine mandates and claims to have treated women with adverse reactions to COVID shots. Other appointees include pharmacist Hilary Blackburn, who has hinted at a possible link between vaccines and autoimmune problems, a claim unproven by research. Transplant surgeon Raymond Pollack rounds out the list, though little is publicly known about him. And this is the part most people miss. These 5 advisors will join 8 others selected directly by Kennedy after he unceremoniously dismissed the previous 17 committee members, a move without precedent. Already, watchdog groups like the Evidence Collective documented more than 50 factual errors in the initial meetings of Kennedy's hand-picked committee. With up to 19 total seats, 6 more committee spots remain to be filled, and traditionally, selecting and preparing new members is a lengthy process that takes careful vetting and thorough training. The current rapid overhaul bypasses standard procedure, fueling even more controversy and concern. Now, let's open the floor. Should personal beliefs and skepticism about vaccines play a role in shaping national health policy? Will this dramatic shift lead to greater safety, or could it inhibit protection against dangerous diseases? If you have strong feelings, either in support or in opposition, don't hold back. Share your perspective below. The future of public health could depend on voices like yours.